Order. I call this meeting to order. This is the Standing Committee on Health. I'm John A. McDonald, the MLA for Hants East, and the chair of the committee. Today, we'll be holding an agenda setting. Please make sure you put all your phones on silent. I'll now ask the committee members to introduce themselves by stating their name and the constituency that they represent, starting with the Vice Chair, MLA Barkos.
Good morning, or afternoon, everyone. MLA Barkos, or Danielle Barkos, MLA for Chester St. Margaret's. You can tell I had a summer vacation.
Hello, everyone. Happy New Year. Chris Palmer, MLA for Kings West.
Hello, I'm John White, MLA for Glace Main Dominion. Happy New Year, everyone.
Nolan Young, MLA for Shelburne.
Hello, Susan LeBlanc, MLA for Dartmouth North.
Good afternoon, everyone. Rafa Di Costanzo, MLA for Clayton Park West.
Good day, Kelly Regan, MLA for Bedford Basin.
For the purpose of Hansford, I'll also recognize the presence of Legislative Counsel Gordon Hebb and Legislative Committee Clerk Judy Kavanaugh. So today's business. Agenda setting. So at the end of this, we should have 6 items, 3 PC, 2 Liberal, 1 NDP. To avoid any confusion, I'm going to ask them to do theirs one at a time, and then we'll debate them and deal with it. And then when we finish all that, we'll wind up dealing with the deferred motion. So first, I'm going to have the PC caucus do their first one. That will be MLA Palmer.
Thank you, Chair. I move that the first topic for the PC caucus be long-term care builds, impact, and approach. Suggested witnesses will be the Department of Seniors and Long-Term Care, Mountain Lee, representatives from the Department of Seniors and Long-Term Care, Mountain Lee Lodge Administrator, or that would be their first choice, or Queens Manor Administrator if Mountain Lee is unavailable, and representatives from GEM Healthcare Group or Shanix.
So we've heard first item. Any discussion on this? Okay, all in favor? Aye. Aye. Contrary-minded? We have one agenda. So the next thing is I'm going to allow the Liberals to go for their first one. I assume MLA Regan? Thank you.
I move the first topic for the Liberal caucus be the links between health outcomes and lack of safe, affordable housing, and the witnesses would be Deputy Minister of Municipal Affairs and Housing, Deputy Minister of Health and Wellness, Deputy Minister of Community Services, and representatives from the North End Community Health Centre, and representatives from ADSM for Women and Children.
Any discussion on this one? MLA Palmer.
So the topic, we don't have any issue with the topic. We think it's a good topic, but I would like to make an amendment to the motion, please.
MLA Palmer.
I moved that the topic, links between health outcomes and lack of safe, affordable housing, the following witnesses appear as representatives from municipal affairs and housing, representatives from community services, representatives from health and wellness, representatives from the North End Community Health Centre, and representatives from ADSM for Women and Children.
Okay, so just to be clear, MLA Palmer, your recommendation is actually the same groups they already did, so I don't think it's an amendment unless I missed something.
Well, the amendment, Mr. Chair, is we're not saying that deputy ministers are not able to appear, but we just want the departments to be able to identify the individuals most associated with that topic. So we're just allowing the department to send the representative that would be the most associated with that topic.
And the Ledge Council had caught me and said, well, this is the difference, how I missed it. Thank you. So is there discussion on the amendment, MLA LeBlanc?
Thank you, Mr. Chair. I would just say that, you know, when we are at committee and we are discussing such important topics, the deputy ministers are where, as we've said many times, where the buck stops, as it were. They are the people who should know all of the answers, and if they don't, then they can bring some help with them, people who might be, you know, directly affiliated with projects or whatever. But really, we should be questioning the deputy ministers at these committees. So while I understand that maybe we want to have the right people at the table, that should be the deputy minister and someone who they choose to bring with them. I don't think we want to have a situation where somebody comes and then can't answer the question, and then we have to, write to the deputy minister or the minister to get the answer. So I wouldn't support this amendment.
Okay, MLA Regan, then MLA White. MLA Regan.
I do appreciate that the member would like people most closely associated with the programs to appear before the committee. However, it's been my experience that they can't always answer some of the bigger questions. I have no problem with saying Deputy Minister of Municipal Affairs and Housing and such representatives as the Deputy Minister deems appropriate to bring with them. That's not a problem at all if they need to have somebody else with them. But I think it's really important that we hear from the Deputy Ministers. These are the people who are responsible for these programs within government, and they should be here, and it's part of their job.
MLA White.
Thank you, Chair. We actually agree with what you're saying. We do technically agree with what you're saying, and I just want to go on record here saying that I think it's a fabulous topic. I really do see a direct link here. We're not saying deputy ministers can't come. We're saying that we want to have the people who have the best information for it. The deputy ministers can gladly attend. I'm fine by that. But I do want to make sure we get some answers here because I think the topic is very important. So what we're trying to say is that we bring in the people who have, the departments know who best have the information. I think that's what we're trying to say here.
MLA, hold it. I think MLA DeCostanzo.
Thank you, Chair. Yes, so I think we are in agreement. We want the deputy, and whoever the deputy wishes to bring with them, we're more than happy, so we can change ours and representatives as necessary. We can add that to our motion.
Okay, so MLA Palmer.
Well, I just want to be on the record saying we agree with the topic, as my colleague said. I think it's a worthwhile topic to have a discussion about. The conversation around maybe other representatives not having the information and having to come back to us, the committee, with answers. It could be the opposite if maybe the deputy would get into the weeds with some questioning and then the deputy has to come back. So our approach here is that we just feel that the department can most closely identify the people that will bring the relevant information on that topic. So that's
MLA DeCostanzo.
Thank you, Mr. Chair. We've seen it over and over again. They bring the staff that they need with them. So we welcome them, and that's how it should be done. That's how it's been done. And so the deputy is the person who's in charge, and they need to answer the questions. Thank you.
Seeing no other discussion? Okay, all in favor, aye? Aye. Of the amendment. I apologize. Thank you, MLA Regan. On the amendment, all in favor, aye? Aye. Contrary? Nay. The ayes have it. So on the amended motion, all in favor, aye? Aye. Against, nay? No, it has to be voted twice. First is the amendment, then the amended motion. So this is on the amended motion. I've done the ayes, nays.
I meant to say aye.
No problem. Motion passed. So that was Liberals. So I'm going to go back to the PC. So MLA Palmer.
For our second topic, I move that our second topic would be withdrawal management services. The suggested witnesses are Nova Scotia Health, Dana Pulsifer, Senior Director, Mental Health and Addictions Program, Office of Addictions and Mental Health, Deputy Minister and Representatives, Dr. Samuel Hickox, if available, and the Ally Center of Cape Breton and/or Direction 180.
Okay, any discussion on that? All in favor, aye? Aye. Contrary? Okay. So I'm going to have the NDP, MLA LeBlanc.
Thank you. We'd like to move as our topic, the first one on our list there, privatization of healthcare in Nova Scotia. The witnesses would be the CEO of Nova Scotia Health and representatives, the Deputy Minister of the Department of Health and Wellness and representatives, the Executive Director of Nova Scotia Health Coalition, and then representatives from NSGEU and CUPE Nova Scotia.
Okay. Discussion. Emily Palmer.
Thank you. I'd like to make an amendment that I would like to propose that, move that the topic privatization of healthcare in Nova Scotia be changed to private-public partnerships in healthcare with the following private-public partnerships in healthcare with the following witnesses: representatives from Nova Scotia Health, representatives from the Department of Health and Wellness, Nova Scotia Health Coalition, NSGEU, CUPE, representatives from Doctors Nova Scotia, representatives from the Pharmacy Association of Nova Scotia, PANS, and representatives from the Nova Scotia Dental Association.
Just writing all that down. So, one second. Okay, so Emily Palmer, which question?
Oh, no, didn't know if we might be able to, maybe a context.
Oh, yes, go
Or
ahead.
just-
That's why, that's,
Yeah, so I'm not really out to change maybe the content of what we'll be speaking about. I just feel that the title in of itself, privatization of healthcare, it just might be a little bit more misleading to the public in Nova Scotia. So I think what's happening is this topic, I think, is better reflected by displaying the private-public partnerships in healthcare, and to have other representatives from that private sphere who are working with the government is better discussion to have with the topic.
okay, so I'm just going to ask you, and then I'm going to, I seen Emily LeBlanc first, and then I'll get Emily. So I just want to be clear, is the topic name, because I wrote down private, public, healthcare Nova Scotia, in Nova Scotia, although, but then you said private public partnership, so I just need to know for this, which is it?
Okay, yeah. Chair,
And Hansard might have it right, I just might have heard it wrong.
Just to clarify, the topic title to be public-private partnerships in healthcare.
Okay. Okay. Emily LeBlanc.
Yeah, thank you very much. I'm fine with the title change, or the topic title changing. But I do think that's a kind of a lot of witnesses, and so I would like to suggest that perhaps, we could humbly drop one of our suggested witnesses if we could also drop one of the government's suggested witnesses, so that we just have less people in the room. I mean, I think we can get at the situation or at the topic with with not so many people in the room. So my suggestion would be that we could let go of CUPE Nova Scotia, for instance, if we don't, and we also don't invite Doctors Nova Scotia, not Doctors Nova Scotia, the Dental Association of Nova Scotia, sorry. So then it would be Nova Scotia Health, Health and Wellness, the Health Coalition, NSGEU, Doctors Nova Scotia, and Pharmacy Association of Nova Scotia, just to keep it a little bit less unruly.
Okay, so I'm going to let Emily Regan, she had her hand first. Emily Regan.
So what I will say is changing the topic, to me, changes the focus, number one. And that's why you have to actually add in all those extra witnesses to water down what the original topic was, which was privatization of healthcare in Nova Scotia. So while I applaud my colleagues' generous offer, I do believe that we should not be changing the title, and we should not be adding in all of these other witnesses, which will guarantee that we won't get to hear very much from any witness that has anything significant to say.
Okay, so I seen MLA DiCostanzo first, then I'll get to you, MLA White. MLA DiCostanzo.
Thank you, Chair. My concern is, are they all having opening remarks and how long? So we have to, if we have too many presenters, we need to limit who gets to do the remarks and how long. That's an important.
Okay, so, and I can comment on that, and that's because the chairs, so for this committee, the total remarks will not exceed 15 minutes. So it's broken up that way. The chair, I say not the chair, but the committee clerk did a great job in the first one by taking care of that, and that's how she explained to me. So whether there's 3 or 30, no more than 15 minutes, so it'll be broken up accordingly on that portion. Okay. MLA White.
Thank you, Chair. I have an extreme challenge with privatization of healthcare. That title alone is going to set people off in the province. It's misleading, it really is, because we're not opening up hospitals as privatization. That title does allow for that kind of read into it. So I'm very happy to hear that the NDP are happy to change the name and go along with the public-private partnership, because a partnership is different than privatization. They're two different things. So if I think the offer was to drop QP and drop the Dental Association, I think we're in favor of that. Yeah.
Okay, so,
We're in favor of that.
So there was an amendment, so to remove that from it, we have 2 ways of doing this. One, unanimous consent to remove the amendment and restart it. Or what did you call this? Sub-amendment? What did you call that at PAC? You can have an amendment.
You can have a sub-amendment.
That sub-amendment.
Sub-amendment to
So
amendment,
if,
yes.
so if MLA LeBlanc would entertain a sub-amendment to remove QP and Nova Scotia Dental, the alternative is if you wanted a minute, we could pause this and go to another one. But MLA LeBlanc.
Yeah, so I'll propose a sub-amendment to Mr. Palmer's amendment, and that is to strike keeping Nova Scotia as witnesses and strike the Dental Association of Nova Scotia as witnesses.
Okay, so we have a sub-amendment, which I assume, which means I'm going to be voting 3 times.
Yes.
Just check it. Thank you. Okay, so any discussion on the sub-amendment? All in favor of the sub-amendment, aye. Aye. Contrary, nay. Sub-amendment has passed. So now we have an amended motion. Everybody understands the amended motion? I don't have to reread it? Okay, so on the amended motion, all in favor, aye. Aye. Contrary, nay. Nay. Motion is passed. So now on the amended motion, any discussion? No? All in favor, aye. Aye. Contrary, nay. Okay, NDP topic 1 is there with those amendments. Thank you. Then we'll go back to MLA Palmer for his third.
Thank you, Chair.
PC's third, I should say.
I propose a motion for the PC third topic as cancer screening programs, and our suggested witnesses would be Nova Scotia Health, Dr. Helmut Hollenhorst, Senior Medical Director, I believe. Director, Cancer Care Program, Jill Flynn, Executive Director, Cancer Care Program. The IWK Health with Ann Yule, Breast Screening Program, and Dr. Sean Isles, Department of Diagnostic Radiology, Faculty of Medicine, Dalhousie University.
Okay. Any discussion on that? Okay, all in favor, aye. Aye. Contrary minded, nay. Motion is passed. Will you be taking the other one for the Liberals? MLA Regan.
Chair, I move the second topic for the Liberal caucus be the impacts of labor shortage on the healthcare system, and the witnesses would be the President of NSNU, President of Doctors Nova Scotia, the CEO of Nova Scotia Health, the Deputy Minister of Health and Wellness, and a representative from the Paramedics Union, IUOE 727.
Any discussion on that? MLA Palmer.
I'd like to make an amendment. I think it's a fine topic. we have no problem with the topic, but I'd like to make the amendment as I move that the topic impacts of the labor shortage on the healthcare system. The following witnesses be called: Nova Scotia Nurses Union President, Doctors Nova Scotia President, representatives from Nova Scotia Health, Office of Healthcare Professional Recruitment, and representatives from IOUE.
Okay. MLA Regan.
Again, have no problem with the Office of Healthcare Recruitment being added. However, I do feel that the Deputy Minister of Health and Wellness is the person who oversees the Department of Health and Wellness, and it is most appropriate for that person to appear before this committee, and they can bring whoever they wish with them. I'm perfectly happy to have the Office of Healthcare Recruitment added to it.
Any discussion?
So,
MLA Regan.
thank you very much, Mr. Chair. So I would move a sub-amendment that we, to the amendment, simply that instead of Office of Healthcare Recruitment, it be Deputy Minister of Health and Wellness and whoever they feel
Okay.
appropriate.
One sec. So the reason I asked that question, MLA Reagan, is because the intent of the original motion was to remove the person, replace it. Your sub-amendment is to put it back, which is actually in complete contravention of what their intent of the motion is. So I have to call your sub-amendment out of order. Okay. And that's why I had to ask the question before to confirm it. So MLA Reagan, you still have the floor if you have any questions. So.
Once again, I do feel that we have seen, this is now the second time today we have seen them try to remove a deputy minister from being called before this committee, and I have to ask why that is. This is the ranking civil servant responsible for whatever program, whatever department that we're talking about, and twice today we have seen them try to shield them from responsibility. They're supposed to sit there and answer our questions, and to be quite frank, I'm not sure the Office of Healthcare Recruitment can actually answer some of the questions that we have. I think we need the deputy minister there, and I think this is part of a pattern, and I'm concerned about what I'm seeing.
Okay, so I'm going to ask who went first. If it was, well, thank you, MLA LeBlanc, MLA Palmer, and then MLA LeBlanc. So MLA Palmer.
Okay, thanks, Chair. So again, we're not saying deputies, can't appear, but what we're saying is the topic that the Liberals, which we agree is a valid topic, the motion of impacts of labor shortage on the healthcare system is precisely what the Office of Professional Healthcare Recruitment is for. So we feel that is the most relevant witness to be here. That's why I made the amendment that I made.
So I'm going to let MLA LeBlanc speak, and then I'll get back to MLA Regan, and then I'll get to you. MLA LeBlanc.
Well, I would say first, Mr. Chair, that the Office of Healthcare Recruitment is about healthcare recruitment, but it's not about healthcare retention. And our labor shortages are not just about recruitment. They're also, in many ways, about retention. And so the Office of Recruitment cannot speak to any of those issues. Retention is one of the biggest hurdles we have to a well-run healthcare system right now. And so I would say that that we, for sure, let's have them here at the meeting, but not in replace of senior people from the Department of Health and Wellness. So I can't support the amendment, and I would say, and I would echo my colleague from the Liberal Party to say that it is worrying that the government members are not wishing to implore deputy ministers to be here. If I was a deputy minister, it would not be my favorite thing to come in front of a committee of MLAs. I'm sure most deputy ministers, don't want to speak for them, but most of them are like, oh God, I have to go to another committee. Yes, and that is like a reality, and yet they are the ones that run those departments. They are in charge, and they are the ones who should be able to best answer the questions. So for us to give them the choice of coming, I think does take away the purpose of these committees. Certainly in public accounts, we've had this discussion, and it is the deputy ministers who are called to meetings. I think almost exclusively. And so I think that this amendment should not stand, and we should, but we should, in fact, do another amendment. We should vote on this amendment, and then someone else can propose an amendment to invite the Office of Healthcare Recruitment along with the Deputy Minister of Health.
MLA Regan.
I would like to echo my colleague from the NDP, her remarks. I would say that our deputy ministers make significant salaries. They make double or more what MLAs make. And it is not comfortable to come before this committee. I get it. But the fact of the matter is the buck stops with them. While there's ministerial responsibility, those deputy ministers are running those departments. And I'm not sure that the Office of Healthcare Recruitment can answer why the government, for example, canceled the doctor recruitment bonus for Metro. Why that was canceled, because the result of that is that we now have 4 times the people in Metro on the doctor wait list. I don't think the office can answer why the government decided to do that. But the end result of it is this. And quite frankly, a deputy minister will have more information than simply that office.
Okay, so MLA White.
This is not about deputy minister's salary. This is about recruitment and retention, which the Office of Healthcare Professionals and Recruitment does indeed look after. Yes, they do. And I have not seen a deputy minister squirming in the chair over there about debating on being here. I just haven't seen that. I'm looking for information. I think it's a great topic, and I stand by bringing in the people who have the best answers for the questions we have.
MLA Palmer.
So just my last note on this. We're willing to work with our friends across the table. We even added witness members from the IOUE to the topic. We feel that the people that I've listed in my amendment can really provide the most relevant information to the discussion at that topic. So I just want to leave that. Thank you.
Okay, and one thing I did want to let MLA Regan know is while she was talking, I was asking. So although your sub-amendment before was out of order because you were just undoing it, there's nothing wrong with your sub-amendment if you actually only wanted that minister back. So in other words, where you were trying to replace it, to put it back, if your sub-amendment would have been to add the minister for that, that actually would have been in order. So just letting you know, MLA, the deputy minister apologized. So
I don't understand the difference between the two things.
your sub-amendment was to undo the motion. Had your sub-amendment been just to add somebody, it would have been in order. So MLA Reagan, you had your hand. I just wanted to let you know why I was asking him some questions while you were
Okay.
talking, so you
All
didn't
right.
think I was ignoring you.
So
MLA Reagan.
if I were to say my sub-amendment is to add the Deputy Minister of Health and Wellness to the list proposed by my honorable colleague, MLA Palmer,
That would be in order.
that's in order.
Yes,
Okay.
ma'am.
So I move that motion then.
You moved that sub-amendment.
And I would just say that what I don't want to have happen is that we get questions that can't be answered by the Office of Recruitment, so then we have to write letters. The letters get tabled, because as we're going to see later today, that's what happens when certain people don't want to deal with an issue that we raise. It gets tabled and it gets kicked down the road. I'd like to have the answer to the question at the time when we're in committee, rather than having it just sent in a letter lately, and it's casting no aspersions on people kicking things down the road. I don't want anybody's back up, but I'm just saying that I'd like to deal with it when we have the topic, and that's why I want the deputy minister here.
Thank you, ML Regan. Discussion. Is that your hand, ML? Just checking. I'm wearing my reading glasses, so you're a little fuzzy. MLA White.
I just want to clarify that the issue we're dealing with later is telling a department what to do. It's not asking questions. When we ask ministers questions, or deputy ministers questions, and they don't have the answers, they bring them back to us. They send them back to us in an email so we can get it later if we have to. The people coming in are responsible for answering the questions, and they're expected to do so. And I just want the department to send the people who have the answers so we don't have that. And we're not saying not to send deputy ministers. We're saying send whoever has the answers to the topic we're asking. That's what we're asking for. That could be deputy ministers. We want the executive director. We want whoever we need to get the answers. That's what we're asking for. I'm ready to call the question if we're ready to go.
Okay, so any other discussion? MLA D. Costanzo. I always have to look at your name so I don't mess it up.
No problem. Thank you, Chair. We're just going round in circles with the same thing. The deputy is the person that we need at the table. The public should hear from the deputy. The deputy has the chance to bring anybody they wish. We have no argument. If they think there's certain questions, we already know we have questions that only the deputy will need to answer. We would like the deputy here. That's their responsibility. They show up at all important committee meetings because the buck stops at them and they have the final decision on big issues. So the deputy has to be here, and they can bring whoever they wish. Doesn't matter which topic it is. Thank you.
Thank you. No other discussion? Okay, so we're voting on the sub-amendment. All in favor of the sub-amendment, say aye.
Aye.
Sub-amendment was to, so that's fine, was to bring add the deputy minister to the list. So I will ask that, ask again, since I, all in favor say aye. Aye. Opposed say nay. Nay. Sub-amendment has failed. On the amendment, all in favor aye. Aye. Contrary nay. Motion is passed. So on the amended motion, all in favor aye. Aye. Contrary nay. The amended motion has passed. Checked off the wrong thing. Okay, so we now have the 6 items. The next item on the thing is for the motion. Oh, apologize. Look at this. There's a. I forgot to remind everybody that the clerk will do her best to schedule the meetings in a fair order in accordance to their availability. Thank you very much. I knew they all knew that because they all like you. So we'll deal with the deferred motion. That was a motion on the table deferred from the December 12th, 2023 meeting. The clerk will read the motion for the record. Clerk, thank you.
All right. I move that the Health Committee direct the chair of the committee to send a letter to the Minister of Seniors and Long-Term Care outlining what we heard at last month's meeting. The letter should note that we understand next year's budget is being prepared, and we want to bring these recommendations made by our witnesses directly to the minister's attention. This letter should outline the committee heard compelling cases made for the following improvements to the system, specifically that, 1, to improve the health and safety of Nova Scotia's home care workers and clients. Timely in-person home assessments should be completed prior to initial home care visits. Those first home care visits should be performed by a team of 2 home care workers. Until such time as cell service is extended to the entire province in areas where cell phone service is currently non-existent or unreliable, tracking tags be provided so the locations of workers are known to their employers. Nurse practitioners be hired to ensure clients receiving home care who are not attached to a family practice can receive the timely health care they need. An increase to the budget of Aware NS be included in the upcoming budget. And 2, to improve retention and to ensure the home care system is not being underwritten financially by our home care workers, home care providers, companies and organizations, be required to schedule and pay for continuous hours of work to those workers providing this care. An increase to the vehicle allowance be provided to home care workers using their own vehicles to ferry them to each home care client location.
Thank you, Clerk. So discussion on this. MLA Barkos.
Thank you, Chair. Interesting enough, I'm going to use exactly MLA Regan's words with unnecessary letters. And I feel this is unnecessary. The Deputy Minister was here, she attended the meeting, she participated in the discussion, and I know for a fact that the Minister is aware and has noted the motion and had noted what you had said personally through personal text messages, actually. I messaged her. So I think this is unnecessary. And I think this falls right into what you were saying, or what MLA Regan was saying earlier about unnecessary letters.
MLA Regan.
I don't think I said unnecessary letters. I said I would prefer having the information in the meeting. A letter is preferable to no information at all. And it's lovely that the member has a text chain with the minister. However, coming from the committee, it brings heft. And it's also a public thing. It also lets people know we heard what was said at that meeting. I found a compelling case was made by CUPE about what their workers are going through. I had some idea. I had no idea of the extent. And I think it was an important meeting for this committee. And I think it's important that the minister understand that for us, what we heard was important. I took time to write this up because I felt what I heard was important. And I want to make sure that the minister sees it from this committee, not from her friend, which is valuable and appreciated, that a colleague would take the time to do that. But it is important that she understand that the entire committee believes that this is important as we go into budget. And so that's why I wrote this. Again, this trying to table this and then delay this just simply says that we don't want this information out there. And this letter is important. It should be included. And to suggest that a text chain takes its place, you can and you can make noises all you want.
Order. Just to remind everybody to speak through the chair. MLA Regan.
The honourable member can make all the noises they want. However, I do think it is important that we take what we heard seriously, and we should, in fact, give enough of a darn to write a letter to bring what we heard to the attention of the minister. Thank you.
Okay. MLA Barkos, I seen her hand, and then MLA LeBlanc, and then MLA D. MLA Barkos.
Thank you. I would rather my words not be misconstrued. The Deputy Minister was here. The Minister has made leaps and bounds in her portfolio since government has formed. And she does her due diligence. And I assure you that it's more than just a text message when the Deputy Minister is sitting here answering all the questions. Again, I feel this is unnecessary. I feel it's repetitive. We're not hiding anything. The Deputy Minister was here and, again, answered all the questions, and it's for the public to see. So there's where I stand on this.
MLA LeBlanc.
Thank you, Mr. Chair. Yeah, I just don't understand what the big issue is. It's a letter from a committee. I think it's an important thing to do. I think it's in the same way as when the Public Accounts Committee endorses an Auditor General's report. To not do it is kind of a big deal. And so, why not write a letter to the minister and say, we as a health committee had this great meeting. Yes, your deputy was there. Yes, you have personal conversations and you have relationships with people that were at the meeting. But as a formal gesture, I think it's important. I also think, and I don't disagree necessarily with the MLA, with MLA Barkhouse, that the minister has made leaps and bounds. That's awesome. That's great. It doesn't mean we can't write her a letter and say, don't forget, or please, please do consider this when you're continuing to make leaps and bounds. And if she's done her due diligence, why should she care? If I was the Minister of Seniors and Long-Term Care and I got a letter and I knew what I was doing, then I'd be like, great, thank you, yes, done. I can put that in the done pile and not worry about it. But if I haven't done it, I can be like, oh, great point. Thanks for that. And then make sure it's happening, or not, based on, the policy of the day, or the whim of the government, whatever. It's so ridiculous to be fighting over this. We should just write a letter. It's the only person who is making more work for, unfortunately, is the clerk, and I apologize to the clerk for that, but I bet she doesn't mind. Anyway, just saying.
MLA DiCostanzo.
I'm sure a lot has been said, so all I want to say, this was since December 12th. By now, they know about it. We should have had a response by now. It's a simple letter that shows that we cared about what we heard. And it'll be, I think the minister would be happy to say, no, as my colleague said, this is done, or don't worry, it's on the radar for our government. That's all. Simple.
Thank you. Any other discussion? Okay, ready for the vote. All in favor of writing the letter, say aye. Aye. Contrary, nay. Nay. Motion is defeated. So we have, is there anything else I need to? I'm checking with the clerk, so one quick. I think that's.
Committee, if there's any other business.
Oh, thank you. Is there any other business? Seeing none, I have to find the part where it says we're going to meet again. So the next meeting is February 13th, 2024, 1 to 3 p.m. The clerk will let us know what is going to be on that one. And before we adjourn, just to let you know, one thing I've asked the clerk to look at is if we can do an agenda setting before the end next time, so we don't have to rush or trying to find stuff, so we'll discuss that at a future. So instead of having the agenda setting when we've run out of witnesses, maybe a couple before we'll do it, so keep rolling through. We'll discuss it as a committee. I just wanted to throw it out there, so. And this meeting is adjourned. Thank you.